Welcome to today's Virtual Wellbeing Festival presentation on long-term conditions and in particular managing fluctuating symptoms and their flare-ups. Today's presentation will be by myself, Dr. Jo Brown. I'm a principal clinical psychologist and I'm the lead for staff psychological wellbeing at Northampton General. But these slides were prepared in consultation with Dr. Claire Hallis, who's a consultant health psychologist. So firstly, I'm going to run through the contents of what we're going to be thinking about today. The presentation is going to include what the challenges are of living with a long-term condition and understanding how our emotional health can also be affected. We're going to have a look at how to approach living with a long-term condition and some tips in terms of managing those fluctuating symptoms and flare-ups. And then we'll finish by offering some support and resources to manage those flare-ups and fluctuating symptoms. So when we're thinking about people having a long-term condition, there's a very helpful visual to try and describe what it might be like. It's called the iceberg of chronic illness. And as you can see from the picture here, people see a person going about still smiling, laughing, running errands and socialising, and potentially just looking well and going to work and functioning. However, below that water level, you can see there's a whole lot more likely to be going on for people who are struggling with a long-term condition. So there may be somebody there in constant pain. They may well be spending much of their time pretending to be okay. Often, as you may know, people will be experiencing things like migraines and joint pain and fatigue and even nausea. And then there's all those emotional experiences that a person might have, including the anger and frustration of a change in life experience, perhaps feeling embarrassed and ashamed about things that they can no longer do. And some people may feel loneliness and isolation if they're not able to go about their usual daily life as they once had. And I think the reason this picture is so good at explaining what it might be like to experience a long-term condition is because it shows the bit that people don't see and people don't necessarily think about. So let's have a think about fluctuating symptoms. There are many challenges really of living with fluctuating symptoms, and as I'm sure people are aware, they can really impact on the quality of life and the mood that you might experience. One of the biggest problems, of course, is by their very nature that they are unpredictable and uncertain and can feel or be completely uncontrollable. And so I guess this means for the person that they actually can't plan or know what's happening and they can't make their life predictable. And that can make a person feel really insecure and unstable at times. There are three really common fluctuating symptoms that overlap with long-term conditions, which are pain, fatigue, and brain fog. And we're going to take a look at each of these three. Before we start, there is a common pitfall of living with a long-term condition known as the boom and bust cycle, as you can see the diagram shows. And this refers to a coping behaviour which people often use to manage fluctuating symptoms. And what this is trying to describe is the tendency to be overly active when symptoms are reduced and try and get as much done as possible and perhaps rush around doing all those things you haven't been able to do. And then reaching a peak and coming to exhaustion and then having to rest a lot when there's a flare-up of said fluctuating symptom. What also might happen is that others might reinforce the boom and bust cycle without meaning to. So they might encourage us to avoid social situations when we're not so good, or push us and overload us when we have less symptoms. And so we get into the vicious cycle you can see there on the right. So you have a good day, so you have a really big catch up, overdo it, end up, for example, with increased pain and then need to rest and recover. And that can mean several days out. And if we get into a cycle of overdoing it in the boom and then being unable to do things in the bust, it can feel a really difficult way to live. So we're going to have a think about how to manage that. So one thing that's really important to consider when you're living with a long-term condition and having one of those flare-ups of your symptoms is the effect it can have on us emotionally. So people with a long-term condition often find there's an impact on their physical health. And what that can mean is that their normal reactions are very different and they find life actually very challenging because of the emotional impact of what they're going through. And those psychological difficulties can include worry or low mood or fear, and often involve lots of difficulties in adjustment and acceptance of the challenges that living with a long-term condition can bring. So our little diagram on the right-hand side there shows the middle section, where many people suffering from long-term conditions also have overlapping mental health problems. It's about 46% of people with mental health problems in this country also have a long-term condition, which just highlights the likelihood of the challenges and the difficult experiences that they can bring. And it's also worth considering the different stages of a long-term condition and the impact that can have on our emotional health. For example, when you're first diagnosed, that brings many challenges emotionally, or if you experience, as we're talking about here, a fluctuation or flare-up in symptoms, and when you're thinking perhaps about the prognosis. So why does physical illness affect our emotions so much? So there's a very helpful model of illness behaviour by Leventhal that we have here to discuss. And it starts with the understanding that each of us has a stable set of ideas and beliefs and thoughts about health and illness. And that set of ideas and beliefs is going to have built up throughout our lives, and it's developed in relation to our childhood experiences of health and our family ideas about health and perhaps how we use medicine or not. Cultural beliefs play a strong part in it, as do religious beliefs, and also just the environment. So how is medicine used where we are? What access is there to healthcare? What beliefs are there in our culture about healthcare, and so on? And of course, these beliefs and so on that we build up are strongly linked to how we might think we cope and act when we become unwell, and particularly how we might manage a long-term condition. So in the diagram there, you can see that the health threat that we might see when we are diagnosed with a long-term condition has very much to do with our own identity and understanding and beliefs about the illness and its causes, and also what we think the consequences might be, how long it might affect us for, how likely there is to be a cure, how much control we have over the impact, and so on. And those thoughts and beliefs obviously have a great impact on how we respond emotionally to the illness and how we cope with it. So as we've got written there, the emotional response to that health threat can often include fear and anxiety and low mood, quite understandably. And within this model, we can see it's a circular model. So there's the stage 1 of coping, where we begin to understand our long-term condition and the symptoms and how we think about them, what we believe about them, and the messages that we're given by others about that illness. And in stage 2 in the cycle, you can see there we begin to develop our own style of coping with it. And some of us will cope by approaching what it is we're trying to deal with, about thinking it through, problem solving, and so on. And for others of us, a more natural way of coping might be to avoid thinking about it and avoid coping decisions and problem solving in any way. And the third stage, which also links into the cycle, involves us deciding how we feel about our coping and evaluating our coping. And that, of course, in itself can cause an emotional response, depending on whether we feel we're coping well or we're not coping so well with the long-term condition we're experiencing. So when we're trying to understand our own way of approaching our long-term condition and how we're impacted emotionally, this can be really helpful to piece together an understanding of our own individual emotions and beliefs surrounding physical illness. So how do those beliefs and the thoughts that come from those beliefs affect the boom and bust cycle we just discussed? So obviously we are humans who have thoughts continually running through our minds, which are linked to the way we feel about our symptoms. And of course, those thoughts and feelings influence our coping behaviours. And some of the common loops we can get stuck in with our thoughts about our symptoms include overthinking things. So we can get stuck in that negative rumination loop and continually go over and over the negative impact of our long-term condition. And our thoughts can become overwhelming, causing us to shut down and perhaps experience some low mood and depressive type symptoms. Another common pitfall when trying to cope with a long-term condition is to avoid things such as activities that we associate with our symptoms, perhaps exercise or mental tasks that we find really tiring, perhaps our work or the everyday activities that we used to be able to do without thinking. Maybe even socializing, going out, talking to others, or facing our feelings and symptoms. We also might start to judge ourselves more harshly than we used to. We may have ideas about health that we should be able to cope, or we should be able to just get on with it. And we can end up having quite a lot of inner self-criticism and beating ourselves up for small things. We may also try and overcompensate for our long-term condition and overdo things, trying to still prove our worth or prove that we're still okay or that we're still useful and trying to keep up as we did. And all of these ways of reacting to a long-term condition are really normal, but they can be really unhelpful. And so it's really worth having a look at the way we might be thinking and behaving towards our symptoms and trying to understand, are we falling into any of these categories and is there anything we can do about it? So you can see on our kind of vicious cycle on the right there, we're going to have a little look into the really common fluctuating symptoms of pain, fatigue and brain fog. And we'll try and understand the likely catastrophic thoughts we might have. So that's fearing the worst, or the negative thoughts that we might have. We're going to look at the common emotional reactions and behaviours in relation to those thoughts and those fearing the worst, and some of the things that can cause us to feel helpless in the face of these flare-ups of these very common symptoms. So firstly, we're going to look at pain. So this is perhaps a symptom in a long-term condition that's the most tricky to manage. And some of the common thoughts in relation to a flare-up of pain is that it will never go away and that it'll only get worse. And of course, those thoughts running through our minds, and if we get stuck in that cycle of that thinking, is going to cause us to perhaps have low mood or anxiety or both, perhaps cause us to avoid activities that could cause more pain, and perhaps lead us to those helpless thoughts that we were talking about a moment ago, such as I can't cope or I'm useless. And often if we get stuck in that cycle, it can increase the likelihood that we experience more pain because we are unable to find ways to cope with it. Now, depending on the long-term condition with which someone's suffering, the physical impact and reaction to pain mightn't be what you would usually expect, and you might need to cope in a different way. So what happens is the usual physical impact and reaction to pain drives our immediate response, usually to try and prevent that harm and prevent that pain happening again. However, with long-term pain, this is not always the best way to respond. Sometimes the pain in a long-term condition may require a different focus than the short-term pains that are actually communicating to our body that we need to try and prevent harm. So our beliefs about the timeline of the pain and the cause of the pain and what's best to do in response to the pain are really going to shape how we cope. So pain may be an expected symptom of the condition. If it is, coming to an acceptance of this and kind of working out the best way to cope with it is obviously going to be helpful. So in terms of brain fog, we're using this term to refer to how our brain works. So this is when we experience an impact on perhaps our memory or our attention and concentration or problem solving and decision making, for example, and perhaps our speed of thinking or the time it takes us to process things. So this is a really common long-term condition, fluctuating symptom, and our little cycle on the right shows some of the common negative thinking cycles people can fall into. So for example, if a person is experiencing brain fog, they might be thinking, goodness, I'm going to make a lot of mistakes because of the brain fog, or I'm too slow. And of course, this causes the person to experience those negative feelings again of low mood or anxiety. And we might fall into the trap of then doing too much when the fog lifts, getting into that boom and bust cycle and really pushing ourselves, and then getting really mentally or physically exhausted when we've overexerted ourselves, which then of course causes more brain fog. And the key to noticing ourselves in this cycle, if this is how we're falling into managing some of our symptoms, is to begin to level out some of those boom and bust behaviours. And we're going to talk about how to do that in the top tips in a moment. And finally, the third fluctuating symptom that's particularly common is fatigue. And there are obviously different types of fatigue, such as in the chronic fatigue of a long-term condition, or the physical experience of fatigue as a symptom of other long-term conditions, such as heart failure, COPD, emphysema, and cancer, and so on. So with a chronic fatigue experience, the managing of that boom and bust cycle behaviours is really crucial. It's all about thinking realistically about what activities are useful, how many are manageable, what level of exercise is balanced, and not getting to extremes of time and difficulty. And then thinking about how to motivate yourself and identify the value versus the impact of activity on your symptom fatigue. Thinking about the pros and cons, I guess. It's also really important, as I mentioned briefly earlier, to think about the fact there's mental and physical fatigue, and they actually go hand in hand and can obviously really influence our motivation and negative feelings. So we might need to think about a balance between the mental activities which require less processing time when we're physically tired, and balancing those with the ones that take a lot more energy from us, and in doing those at a time when we feel more able. So on the right there, we just have an example of perhaps how someone who's experiencing fatigue might feel if they fall into that negative thinking pattern and fearing the worst. You might have thoughts such as, I'm stuck in bed a lot, or everyone gets tired but mine never goes away. And that may cause the low mood, the exhaustion, perhaps some guilt and shame even. And that then may cause a person to overdo things on the good days or avoid doing anything at all on the bad days. And then those helpless feelings might be of feeling wiped out and useless, perhaps even feeling a failure. And often people experience a loss of confidence. So fatigue, we need to expect to manage it as a normal part of a long-term condition once we have come to an acceptance of it as being part of our new life experience. So having gone through some of those difficult, the three most difficult fluctuating symptoms and how they can impact us, we want to begin to think about how to manage them. And we've got a few top tips here for you to have a think about. So if you can start off by perhaps noticing if you fall into those cycles I've just described, and then these are some of the ways that perhaps you might try and cope and learn to manage them in a more positive way. So the first tip that we would have is to think about pacing yourself and prioritizing. So it's the obvious things, but sometimes these can get lost if we fall into a negative thinking cycle. So it's thinking ahead and planning ahead for what you might do if you begin to have some fluctuations in your symptoms, thinking about who you can delegate to at those times. It's also thinking about trying to have a regular routine to minimize those fluctuations, and perhaps using an activities diary so you can begin to understand and work out what causes you to have those fluctuations in your symptoms. And as we said, it's really important to think about reducing mental activities as well that create that psychological fatigue, as well as managing your physical activity levels. Then once you've worked out and understood yourself and the impact of these fluctuating symptoms, it's really helpful to prioritize, thinking about which tasks are really important and have to be done, and the ones that have to be done by you, thinking about doing those when you perhaps have less pain or less fatigue, for example. And looking at, in terms of priorities, what's not so important, what doesn't have to be done, and who could you delegate them to. And there's a helpful cycle on the right there, just thinking about the steps that you might go through to try and understand yourself and your own particular individual experience of your fluctuating symptoms and how the planning and routine and activity diaries might help you to cope with them. So the second tip that we have is to also look after your mind, because of course that has an influence on how well you feel in your body. So as we just mentioned briefly, keeping an activity diary can be really helpful. So in a bit more detail, what we'd think about doing is recording everything that you do for 1 to 2 weeks, but not just what you've done, looking at how you feel after each activity, noticing if what you've done has made you feel good, made you feel psychologically well, or whether actually it's impacted on your well-being and you haven't had such a good day. And then looking at the types of activity in as much detail as possible, thinking about what was physical, what was a social activity, what was a cognitive or more thinking activity, what was emotional activity, because some of these can be more tiring than others. And for each individual, the impact of these activities is going to be different. So if you've made a diary and you've been able to label each of the activities in this way, it really helps us identify which impact us personally in which way. And then the diary can help you spot unhelpful activity patterns, things that may cause you to have irregular sleeping patterns, and those boom and bust behaviours that we were talking about. Another really crucial thing, looking after your mind, is thinking about reducing alcohol, because of course this can affect our sleep and our mood really greatly. And so it's important to think about how much it impacts you and how much you might have. One really helpful technique to think about for the well-being of our mind, and this obviously in relation to long-term conditions, but also just generally, are mindfulness techniques. These have got a really solid evidence base for the physiological impact they can have, so how they can help us physically. And they really can promote good sleep and reduce stress. The important thing to note when thinking about mindfulness techniques is that these are a skill to be practiced, and it's not just something you're going to be able to pick up straight away. So first of all, if you do a bit of research into the types of mindfulness techniques out there and find out which one you think might suit you, and then allocate some time, 5-10 minutes per day, at your best time of day, to try and learn the technique so that you can call it in when you're feeling less well. And it's a really crucial part to learning a mindfulness technique, because it isn't something that we can just do easily. It has to be practiced at our best time so it can be brought in at our worst. Another thing that can be really helpful is looking into and ensuring that you have relaxing activities in your week. And again, this is really very much about finding something that suits you. So for some people, that might be an aromatherapy, others it might be yoga or Tai Chi. And then for other people, it may be reading, having a long bath or shower, going for a walk or whatever. There's a really individual experience as to what people find relaxing. So it's important that you find the one for you. And we would say to try and ensure that you experience one of these activities at least once a day if you can, no matter how short. You might have to have a little selection of them, some for when you've got longer time to give to yourself in a day, and others when you might have shorter time. And of course, as we alluded to when talking about the alcohol, a good night's sleep is really important. Symptoms, as I'm sure people know, are much worse if sleep pattern is disturbed. So having really good sleep hygiene and a regular routine is really key. In the resource slides at the end, there are further details on all of these, but just a few tips on trying to get a good night's sleep. It's really helpful, as we've said there, to have a routine, to be going to bed at a similar time each day, getting up at a similar time, to be ensuring that the room where you sleep is just for sleeping in, to be reducing all the caffeine or nicotine, in the early evening, and lots of things like that can really help improve a sleep pattern. And as I say, the resources are at the end to go into that in a bit more detail. So tip 3 is about having balance in your life. It sounds a simple thing, but actually can be really tricky. So we're talking about those real obvious balances between your work life and your everyday tasks, and having fun and doing things that you enjoy. And although it sounds really obvious, sometimes that balance can get really knocked, especially if we're feeling negative and low in mood, and feeling that every time that we feel well enough, we must go and do all the things that are waiting on our to-do list. This can mean that we end up with a really great imbalance in our life, and we're always doing the working or the job type activities to get them done, and we're really missing out on those activities that balance out and really improve our quality of life. So our message here really is it's really okay to prioritize the things you enjoy and get the most out of while you're recovering from a flare-up or trying to manage symptoms, because actually it will aid your recovery and much more likely to get back to a more balanced state and a more positive state if you do share out the working and the difficult activities with the ones that you really enjoy. The other thing that might help you achieve balance in your life and also come to acceptance of perhaps changes that you've had to adjust to if you're now experiencing a long-term condition is reflecting on your personal values. It can be really helpful to spend some time thinking about what your values are and how you've lived by them in the past. And if you're experiencing an impact on the way you used to practice your values because of your long-term condition and a flare-up or an increase in symptoms, thinking about, are there different and new ways in which you can practice those values now that will still give you the same sense of satisfaction and well-being about the way that you're living your life. It's just that you're practicing those values in a different way given your changed circumstances. It's also really helpful to start thinking about how can you gradually begin to do the things that you enjoyed before and gradually change that balance in terms of your quality of life, whether that's your gardening, your DIY, your crafts, your music, reading, singing, whatever it is. And it comes back to the tips in tip 1 that we talked about in terms of planning and prioritizing and trying not to get into that boom or bust cycle. And it may be that for some of you that you have to try and find new interests or new opportunities because of your changes in circumstances, but these might be things that you would never have come your way before and actually might really enhance your life and help you live your values in a way that you never had the experience of before. So a really important part to managing a long-term condition, and particularly at the times when you're experiencing the flare-ups of these fluctuating symptoms, is self-compassion. It can be really easy when experiencing some of these symptoms to have really unkind or negative self-talk, as we already alluded to. And I think we are prone as human beings, and perhaps particularly that when we're experiencing a reduction in our ability as we see it, or our capacity to do things, it can be really easy to fall into a constant routine or cycle or habitual self-talk that's negative about our abilities and our capabilities. So I guess the thing that you can do about this is begin to notice if that's what's happened. Begin to notice how you're describing yourself when you're on your own and those thoughts are running through your mind. Begin to notice what it is you're saying about yourself to yourself, and really beginning to challenge and think about how much fact there is in this and about how deserved or not this might be. And the chances are that you're likely to have fallen into a pattern of negative self-talk that's really not deserved and really not factual. It's more about your feelings and your difficulties and acceptance and change of circumstance. So the key here is to notice, first of all, if you have fallen into a negative cycle of self-talk, and begin to change that to a more caring voice that treats yourself with kindness, particularly when we're managing these flare-ups. And there's something here about imagining what you might say to a friend or a colleague who described an experience of a flare-up themselves, and how kind and compassionate you might be to them, and making sure you use that same kindness and compassion towards yourself. So we have some examples here that you might find helpful. Just remembering that a flare-up in a fluctuating symptom is not your fault. It's not your fault that you find yourself where you are at this moment in time in this body, and that it's nothing that you could have control over. It might be helpful again to think about the fact that you're experiencing the symptoms not being your fault, and that it's just your nerves behaving badly, or your naughty nerves, or whatever it is that's causing those symptoms, rather than something that's you and something within your control. The bit that can also be helpful is having some belief about your ability to manage it and your ability to have some impact on these flare-ups. So acknowledging that whilst it isn't your fault that you're having these symptoms, but there is something you can do about it, can be really helpful, because it gives you that belief that you can take some responsibility about how you choose to act in relation to these experiences and how you respond to the symptoms, because then you may have more chance of preventing or increasing the periods of positivity and low symptoms, and you will perhaps be able to build your belief in how much you can cope with them. Essentially, we're asking you to think about a non-judgmental approach towards yourself, as you would do with others, and ensure that your kindness and the way you might talk to somebody else in the same situation is that you learn to direct that towards yourself. Now, I'm very aware that this is quite a tricky thing to do and sometimes quite uncomfortable, and it can take, as I've said with the other things, quite a lot of practice. So the first step is to notice if you're being unkind and harshly judging yourself, and the second step is to try and do something about it, but that may take some time and some practice, because it is quite hard if you've got into a negative cycle of judgment of yourself to change that. So we have some ideas of ways to build steps to self-compassion. And I already alluded to this. Treat yourself as you would a friend. Sometimes this helps us get out of harsh judgments that we would only, for some reason, reserve for ourselves. As I said, become aware of your self-talk and notice that inner critic, and try turning it around and rephrasing it. It's often really helpful when you're trying to turn things around and rephrase it to look for the facts in a statement, or is it just a thought? And if it is just a thought, it's much easier to challenge with the facts behind it. It can be really helpful to acknowledge the symptoms that you're having, notice and name them, and also notice and name the difficult thoughts and feelings in relation to that symptom. Because if we try and avoid these thoughts and feelings surrounding them, they often come up at times when we're least expecting it, and it won't actually process those thoughts and feelings for us. It just avoids them until another time. It's also really important to validate the symptoms and acknowledge that they are a natural part of being human and a natural part of the condition you're experiencing, and not a sign of weakness. As I touched on earlier, trying not to judge yourself too quickly is really helpful. And if you are experiencing some of those negative thoughts about yourself, it's really helpful to see them as just words rather than facts, and this makes them kind of easier to dismiss. We have a phrase here that says, hold yourself kindly, which is referring to trying to talk to yourself kindly and giving yourself support and understanding. And I think this is something that we don't often think about or talk about. And again, it's that skill to learn of realizing that the more you're able to be kind to yourself and support yourself and understand yourself, actually, the more able you're going to be and the better able to cope you will be. And then kind of learning to do that, you'll be able to reap the benefits. So as I mentioned, we've got some resources here that might help you with some of the things that we've been talking about. There's some books and some on specific experiences of living with long-term conditions, and also some of the skills that we've discussed. So hopefully some of the themes that we've talked about here today have been helpful. I'd like to thank any of you that have listened in, and I hope you're able to use some of the resources to begin to help you in managing the fluctuating symptoms and flare-ups that you might experience in a long-term condition in a way that becomes helpful and improves your well-being. Thank you.